Dr. Ravi Rai, respected madam. The topic, the importance of patient education, clinical and homeopathic, in the management of diabetic mellitus type 2. My both the colleagues and friends already given the whole picture. What is the monstrous disease diabetes is? It is one of the killer. In spite of so many information, so many research, the diabetes goes on increasing, and it is said that it has become a community health problem. I will be focusing on three important issues. Why the education is needed, and the foundation of the study of the work which we have taken up, work done, outcome and results. This is the one example. A young man, 35 years old man, working in a multinational company, is wedded to success, working day and night, work pressure, a brilliant man. But annual checkup, when he goes, the diabetes entered his life. No symptoms, only in the family history, the mother suffered from diabetes. Once the diabetes comes in life, all of us know a person is called he is diabetic. It becomes a stigma in his life. His own life changes, and everybody becomes advisor. The family advisors, physician advisors, friend advisors. Change your life, follow diet, follow exercise, take the medicine in time. The person's whole life changes. In spite of doing all these things, he finds his diabetic doesn't come under control. He passes through frustration, anxiety, tension. He says, Dr. Saab, I am doing this, but my weight is not decreasing. I am following diet, it is not. And family become burden to make a special diet for him. Everywhere he finds the life becomes difficult. And from where to find the time? Working day and night. For finding time for go for a walk, doing exercise or meditation, whatever it is, it becomes very difficult. And he says it is very easy to advise, but it is very difficult to follow. Because lifestyle, diabetes is a lifestyle disease. Unless lifestyle is changed, nothing can be changed. Status goes on mounting, because performance in the work area goes down. Family becomes how long we are going to follow him, diet, this, and the diabetes becomes enemy. The whole life which was a comfortable, happy, enjoying so-called, become a miserable, and diabetes becomes the enemy for him. And he asked question, why me? Why me I am suffering from diabetes? And taking modern system of medicine, results have become very easily available. If the blood sugar comes down with one tablet, lifestyle doesn't change, tablets become 2, blood sugar comes down, again continues, blood tablet 3 times, and diabetic type 2 patient, they also, after the effects of tablet goes away, they are put on insulin. Then he says, how long this will go on? Then what is the option? They come and try for homeopathy. And for homeopathy there are so many questions. Whether the sweet medicine will help me, whether so small doses, this monster of disease, can it cure? Can it reduce my blood sugar immediately? Do I have to take extra dose to compensate? Can it deliver the permanent cure? So many confusion, so many things, and all of us, learned audience know, the diabetes is because of deranged susceptibility. A person in diabetes has to be treated with a similar force. That is what we know. But the most of the patients says, no, come my blood sugar down. And whether blood sugar which is noted today, whether diabetes started today, or diabetes started long back, 7 years, 10 years back, and person was not aware. He was busy in his own life. There is no time for to investigate. And then the work, the foundation of our work, Dr. Jocelyn, before the insulin era or when the hypoglycemic agent come up, he in his own practice was treating patients with making a life change, spending time with the patient, educating the patient. And he says a person who knows his diabetes will live longer. Dr. N L also is a living example, and he said how to live the life. Go for a morning walk, whether it is winter, monsoon, whatever it is, go for a walk. And he said the patient should be made aware about organon. If he wants to have homeopathy, he should be familiar with organon. If he is familiar with organon, his observation will be good, his reporting will be good, and it is possible that we will be able to find symptom and we are going to help the patient. And both, Dr. Jocelyn also said the present line of treatment is a substitute element treatment. It is not acting on the basic susceptibility. The blood sugar can come down with the medicines, but for care it is necessary to treat the patient with diabetes. Not only diabetes, treat the patient and diabetes. So today, what Hahnemann said long back, modern medicine also giving importance to the person, treat the person with diabetes, with the patient with the diabetes, and all my colleagues mentioned the holistic approach, concept of totality and individualization, and concept, this has to be known to the patient about education. Everyone educate the patient, everybody, but will the patient listen to it? No. And we have done this project. 90 patients have been taken. They have done orientation program.
Dr. Tiwari, 2 minutes left only.
Orientation program. And these patients, we have found a diabetic club. Here the patient, they come together. The patient suffering from diabetes for 5 years, 10 years, 20 years, and benefit of homeopathic medicines. They share their experience with the other patient and empowering them how to conduct the life, how to live the life. And they share that homeopathy helps them to reduce their hypoglycemic agent, reduce their insulin doses, and they are now free from hypoglycemic agent and insulin and only on homeopathic medicines. And this has become a discussion. Patient asks the question, doctors, this is Dr. Prashant, who is working with me, conducting the meeting, and discussing with the patient, trying to clear out their confusions. And they already said the diabetes disease, what it is, should be said in a simple exhaustion can be symptom, or can be myocardial can be presentation of diabetes, or coma can be presentation. Patient comes with a coma, you do blood sugar is high, myocardial patient is there. So simple itching or exhaustion or tyrant irritation can be presentation, or can be complication can be presentation. Dr. Zharle, who practiced, he always made a point, first make a change in the life stage. Unless lifestyle changes, no system of medicine can work. And he demonstrated how to educate the patient, and with homeopathy we got various results, and there are so many studies, all of you know, constitutional remedy or phase remedy, whatever it is. And this is the work, attendance of patient, orientation program, 75 were regular, 27 irregular, and role of homeopathy understood by 86% and 14 were found difficulty to understand. 72% accepted diabetes as my friend, and with that the result we found people who attended 76% were controlled and 24% found difficult with this. So if we accept diabetes as our friend, not as an enemy, follow the change in the life, follow in the other things, result can be better, and the enemy can convert into the friend. These are the results.
Dr. Tiwari, please bring it to an end in about 15 seconds.
Right.
Its time is up.
Right. Okay. The education is just not the part of the treatment, but it is a treatment. This is the message we got from our work. Thank you very much, sir.